My name is Ben Chu. I'm a consultant plastic and reconstructive surgeon who is based at the Canispan Plastic Surgery Unit at Glasgow Royal Infirmary, and I also undertake independent practice at Ross Hall Hospital. So treatments that I offer here at Ross Hall Hospital involve breast augmentation for the ladies who are looking for aesthetic enhancement of their breast size and shape. For the ladies with developmental disorders such as underdevelopment or asymmetry, then it gets a little more complicated than that, and it requires a combination of techniques in terms of either enhancement with implants or adjusting the size and shape with other techniques. For the ladies who have volume loss and sagging over time, then they have breast uplift surgery, which is a mastopexy. This may or may not require an implant depending on the patient's desires and what endpoint they choose to have. For the ladies with extremely large breasts who want the breast size made more in proportion with themselves and take breast reduction surgery, and for the patients who have abdominal concerns with the appearance of the abdomens, I undertake abdominoplasty, or what's known commonly as a tummy tuck. All surgery has to be properly assessed, and so patients attend for a clinic consultation for a discussion in the first instance where we explore what they hope to achieve through surgery, a full history on their medical conditions, previous surgery they've had, medications, also their jobs. It's very important to determine what they really want out of the surgery and what motivates them. And an examination is undertaken so that we can assess what is required and how best to get to an endpoint that the patient wishes to get out from the surgery. When I started working here in Ross Hall Hospital, I was struck by two things, which is why I've worked here very happily for 12 years. The first and foremost is it's a facility with continued investment, so it's very reassuring that in terms of infrastructure, staffing, equipment, the service can be delivered safely, and the track record here of safety is impeccable. But actually, besides that, you can build the finest hospital on earth, but you can never actually get the hospital to be what you want if you don't have the human resource for it. And what struck me particularly about working here is that many of the staff who are here in this building have worked here for years, far longer than I probably will ever work in this building. And it says something about the way the hospital is run, because if the hospital can retain staff for so many years, you get key experience, staff who they're effectively the linchpins that keep this place running. And if they can be retained for so many years, then they have to be doing something right. And it is true, staff morale here is exceedingly high.